All right, this is Mrs. Lewicki again. This is the last of our PowerPoints on communication. And so this is the fourth of four. I'm going to talk about the nursing process as it relates to communication. Now, I know that we won't really be talking about the nursing process for a few more weeks in this class, but this is just to give you an idea. In the previous PowerPoint, we talked about things that as the nurse you're going to assess for to see if the patient's able to communicate and to make for effective communication. So now we're going on to the next step. And the next step in the nursing process is we have a nursing diagnosis. And we'll talk a lot more about that in the coming weeks. But what the textbook has done for you is given you six nursing diagnoses. One is impaired verbal communication. One is anxiety, because you can imagine that if somebody is unable to communicate, that would increase their anxiety and make them feel powerless. They could have situational low esteem. They could feel socially isolated or have impaired social interaction. Planning is the next step, and the planning piece is where we would do the goal setting for the patient. So what is my goal? If I set a nursing diagnosis of impaired verbal communication, what is my goal for that patient? Well, my goal would be the first one, establish an effective means for the client to communicate needs. We'll talk more about how to make it a SMART goal, but for right now, this is adequate. We want to maximize the client's ability to perceive messages accurately and obtain resources as needed to optimize the client's ability to communicate. The next step in that is implementation. So sometimes it's a matter of manipulating the environment. So limit the distractions, offer a quiet environment for communication. Make sure there's sufficient lighting, especially if there is a visual impairment. We want to acknowledge and praise any attempts at communication. We want to provide support, and we do that by conveying encouragement. Let the client know if you don't understand, and ask open-ended questions. We want to employ measures to enhance communication. So how does the patient best receive messages? We want to look, listen, touch them. Do they do better through an interpreter? How do they best receive the message? Enhance communication with individuals who are hard of hearing, and recognize and compensate for clients' hearing problems. Sometimes we need to speak in a louder voice. Sometimes we need to provide it in written form as well. Avoid potential cultural barriers to communication. So some of that, and especially as a new nurse, you're going to fall into the trap of using a lot of medical terminology. But medical terminology, we speak a language all of our own, and so that is very confusing to patients. We want to avoid slang and buzzwords, especially for somebody who's of a different culture, because they may be able to speak the English language but not understand some of our local idioms. We want to speak clearly, directly, and at a normal pace. Avoid speaking too slowly. Select gestures with care because meanings are not always universal. Smiling, be aware that smiling and eye contact is not always appropriate in other cultures. Sometimes it's seen as insulting, so be aware of that, as well as greetings. Sometimes we become very familiar and call people by their first name. It is always good to ask them what they would prefer to be called, and use interpreters when necessary. We want to educate the client and support people. So prepare the client, support people in advance with anticipating communication problems. So especially procedures that obstruct the throat and mouth. So if somebody's going into surgery or they're going to need an advanced airway, one of the most important things to communicate with them is the fact that they're not going to be able to speak for a while until that advanced airway is removed. And practice beforehand. And so sometimes patients will mouth words if they have an advanced airway or write notes, and it's important for them to know that's going to be a problem and talk about how to overcome it. The last stage in the nursing process is evaluation. And so what we're evaluating is our goal or our plan. Is the patient able to communicate effectively? So we'll look at it from the client. Are their communication needs being met? Are they establishing a method of communication? Are they perceiving the message accurately and communicating effectively? Are they regaining maximum communication abilities, minimizing the amount of fear, anxiety, and frustration over communication, and using the resources appropriately? So that is the nursing process in a nutshell. In our nursing practice, we want to make sure that we use communication dynamically. It's a dynamic process. We're gathering assessment data. We are always teaching, even from the minute we first meet the patient. That is part of what we do, and communication is how we do that. We teach. We might persuade a patient, somebody who doesn't want to take their medicines. We might need to persuade them to do that. Collaborate with other healthcare professionals. We advocate for our clients. We express caring, and we provide comfort. And that is the last of the communication PowerPoints. The next set of PowerPoints will be on therapeutic communication, which is what we do as nurses.